Assalamu alaikum. My name is Maria Muhammad Aris. My roll number is BP 1650120 and my drug is Dactinomycin. Dactinomycin is a chromopeptide antineoplastic antibiotic. It is also known as actinomycin D. It is a chemotherapy medication used to treat a number of types of cancer. This includes Wilms tumor, rhabdomyosarcoma, emic sarcoma, trophoblastic neoplasm, testicular cancer, and certain types of ovarian cancer. It is given by injection into a vein. It is isolated from bacterium Streptomyces parvullus. It intercalates between adjacent guanine cytosine base pairs, blocking the transcription of DNA by RNA polymerase. Rational use of dactinomycin is to treat certain type of cancerous tumors. Dactinomycin is a type of antibiotic that is used only in cancer chemotherapy. It works by slowing or stopping the growth of cancer cells in the body. Irrational use of dactinomycin may lead to sores in the mouth and on the lips. It may also lead to stomach pain which is continuous. Unusual bleeding may occur. Weakness, difficulty with swallowing may also occur. Adverse reactions of dactinomycin include infection, alopecia, rash, dysphagia, fatigue, neutropenia, thrombocytopenia, mucositis, and hepatotoxicity. Dosage form of dactinomycin in adults is 500 mcg or 0.5 mg intravenous daily for a maximum of 5 days is given, and in children 15 microgram per kilogram or 0.015 mg per kg intravenous daily for a maximum of 5 days is given. Dactinomycin brand names available are Actinomycin 0.5 mg injection and Decilone 0.5 mg injection is available. Alternative of dactinomycin is carboplatin. The findings show that carboplatin can be used as an alternative drug in the primary treatment of rhabdomyosarcoma in case that actinomycin is unavailable or if it is not tolerated, then carboplatin can be used. Drug-drug interaction. Abcicimab with dactinomycin cause risk of severity of bleeding. Abemacicib, it may decrease excretion rate of dactinomycin which leads to high serum level. Case study. A 4-year-old boy was second child among 3 in his family. The child lived with both his parents and brothers. Mother of child had unplanned pregnancy and gave birth by a C-section. There were no history of neonatal sepsis or jaundice. The boy was breastfed for 1 year. The first symptom occurred in right side of abdomen, small in the beginning, then quickly become larger and asymmetrical. Before that, hematuria with clots occurred intermittently and child cried each time of urination. Soap notes. Subject, age of child 4 year, weight 15 kg, height 100 cm. Heart sound and lung sound was normal. Not changes found in bowel habits. GIT was abnormal. Complaint is pain in right side of abdomen and hematuria with clots occurred and child cried each time of urination. Object. Lab results showed increased concentration of Hb, that is at 85 gram per liter, and low WBC count, that is 3.27 gram per liter. Platelet count was normal. Urinalysis reveals presence of blood in urine. Abdominal X-ray showed elevated abdominal side and asymmetrical. Differential diagnosis, ultrasound is done, imaging test, and CT scan showed that patient has Wilms tumor. Wilms tumor is most common solid renal tumor of childhood, accounting for roughly 5% of childhood cancers. They occur in either kidney with equal frequency. In 5% cases, tumors are bilateral. It is a form of kidney cancer that primarily develops in children. Nearly all cases of Wilms tumor are diagnosed before the age of 10, with 2/3 being found before age 5. Wilms tumor is first noticed because of abdominal swelling or mass in the kidney that can be felt upon physical examination. Management, it depends on staging. There are various stages of tumor. Surgery is a method of choice. Standard treatment starts with surgery to remove the part of kidney containing tumor. These children needs to be watched closely because the chances of reoccurrence are higher. Chemotherapy is given for 18 weeks. Treatment options are nephrectomy, unilateral cases, and chemotherapy is given adriamycin and actinomycin D for 15 minutes. Radiotherapy used to reduce the size of tumor. Wilms tumor may be bilateral or large in size, may be inoperable. For such cases, radiation therapy may be used to reduce the size of tumor so that surgery can be performed. Properative care. Prepare the parents and child for surgery. Explain parents not to palpate the abdomen of child. Explain child about post-operative care if he or she is old enough. Caution should be taken while turning child and handling child. Thank you.